My name is Shelby Evans, and I am an EMT with ESSEX Rescue. I wasn't sure what it was going to feel like to ride around in an ambulance. I wasn't sure if I was going to get motion sick in the back of the ambulance. It was a relief that that didn't happen. But yeah, I didn't know if it was going to be a lot of fast-paced, high-energy, scary situations. And it turns out that it's usually not. Most of the time, what we're doing is helping someone who's ill rather than injured. We do see some traumatic injury, but mostly it's helping someone who's ill and needs transportation to the hospital and needs some care en route to become more stable. I think that part of it is that unknown factor, right? You don't know until you get there what it's going to be. And situations sometimes change on you. So something that seems really simple at the outset may become more complex. So it certainly keeps you on your toes, whether you're having a call that appears to be quite simple and benign. You stay engaged because you know that that could change. Every call is different, every scene is different, every patient is different, every day is different. That's part of what's fun about doing EMS. That's one of the things that makes you feel secure when you're going into an unknown situation, is that you're secure in your crew, you're secure in the roles that you're going to take on once you get to a scene and who's going to do what. We definitely talk about that as we're approaching a scene. I mean, we don't always have all the information. We have some information about what we think we can probably expect, and we make a plan, we make a game plan in the ambulance before we arrive about, you know, I'll do this, you'll do that, you'll bring this, we'll use this equipment, and that's where we'll start, and we'll see from there if there are different things that we need or if we need to change course. The two primary reasons are because it's really a great feeling to be a part of a community in this way, to contribute to people's health and well-being and comfort, and to feel that trust among our community members because of the work that we do. And then the flip side of that is because it's a challenge. It's a challenge to have each call be different, each patient be different, each day be different. That's a compelling challenge to me. You're always learning. There's always an opportunity to get better, to make your skills sharper, to perfect your approach and practice. That's what feels good as well. So I think it's those two things. I think it's the sort of the good feeling of contributing something positive, and I think it's the personal improvement aspect of feeling like I'm doing something challenging and continuing to rise to that challenge. EMS is definitely a major safety net in the state of Vermont. We're so rural and so spread out that pre-hospital care is really important, and volunteers are definitely the backbone of that. So in terms of keeping your community safe and healthy, in terms of educational opportunities for your community to help prevent illness and injury, EMS is a big part of that and a really important part of it. I would go try it. You can't know how you're going to feel about it until you actually experience what it's like. So if you're curious, go and find out in person. See if you can do a ride-along, see what it's like to actually be in the back of the ambulance, and talk to the people who do it. Most EMS people would be happy to speak with you. We're always looking for new recruits. We're always interested in talking about what we do and trying to get new people interested in it. Talk to us about how you think it might fit into your life because of how it fits into our lives.